Hello, I'm Dr. Şükrü Akyüz from Istanbul, Turkey. In this video, I'm going to summarize heart attack for non-medical persons. The heart receives oxygen through its own vessels and not from the blood found in its chambers. The wall of these vessels may develop progressive buildup of a fatty substance called plaque in some people. These weak areas may suddenly rupture. The corrective mechanisms in the body then immediately come into play and try repairing the ruptured area by recognizing it as a wound and plug it with a clot. The clot, however, may sometimes completely block the vessel inadvertently, either because it's too large or because of the chronic narrowing at the ruptured site. As a result, vessel blockage suddenly prevents blood from reaching the area beyond occlusion. The tissue in that area starts to die and permanently damages if the vessel is not immediately opened by intervention. This is essentially what we call a heart attack. If the heart muscles dies, electrical stability cannot be maintained and serious rhythm disturbances may occur. Heart failure, a decreased pumping power of the heart, may also develop. These may cause the patients to feel sudden pain, discomfort, tightening, or a burning sensation in the chest. Other common symptoms are shortness of breath, nausea, dizziness, and sweating. And lastly, sudden death can occur. The initial test performed in a patient who is admitted to the emergency room with one or more of these symptoms is an ECG. Electrical imbalance in the damaged area may reveal itself in the ECG. However, this abnormality may sometimes go undetected in this test. Normal ECG does not exclude a heart attack. Hence, we do a blood test. Some substances from the injured cells escape to the outside of the cell, pass into the blood, and can then be detected in a blood analysis. Sometimes it takes a certain period of these substances to reach a detectable level in the blood. Even if the first blood test is normal, it should be repeated a few hours later. The fundamental treatment in a heart attack is to open the vessel as soon as possible and provide blood flow to deliver oxygen to the associated heart muscles before permanent damage occurs. An emergency angiography is therefore performed. In angiography, the occluded vessel is identified, the clot is broken into small pieces, usually by inflating a balloon, and then a stent is implanted. Stent is a wire mesh that acts as a scaffold to keep the vessel open. However, stenting is not always feasible, and sometimes emergency heart bypass surgery may be required instead. The more time that passes without treatment, the greater damage to the heart occurs. In rural areas where emergency angiography and stenting are unavailable, certain blood thinning and clot dissolving drugs are administered intravenously. These medications may open the vessel and prevent the injured part of the heart from dying during transport to a hospital that offers stenting. Thank you.